Welcome to our newest episode of the Lebanese Physicians Podcast. And today we will be discussing nursing in times of COVID-19 and economic crisis in Lebanon. Our guest today is Dr. Myrna Doumit, who is an associate professor of nursing at the Lebanese American University and the president of the Order of Nursing in Lebanon. And she has been involved in the nursing situation and nursing care in Lebanon for a long time, and especially over the past year and a half. We will start the presentation today with a presentation by Dr. Doumit and subsequently a question and answer session. Dr. Doumit, welcome to the podcast.
Thank you, Khalil, for this nice introduction, and good day to you. It's evening in Beirut, and I'm happy to be with you. As Khalil mentioned, I will start by sharing a presentation about what happened with the nursing workforce, the challenges and opportunities since 2019 until now. So I wish we only dealt with COVID in Lebanon. As I always say, it would have been much, much easier on us. But we lived under several catastrophes, one after the other. So we started with October 17, 2019. It was the revolution, and our nurses, some of them had to stay more than 30 hours in the workplace because the other team was not able to reach hospital to really replace them. And many nurses had to come walking, and we had to plead people on the streets to allow nurses to pass in order to be able to really do their job and be in the hospitals. And this situation lasted for many days. Then February 2020, we had the first case of COVID. And here I would like to mention that as Order of Nurses, in collaboration with WHO Lebanon, we started training nurses, emergency room nurses, nurses working in ICUs, in primary healthcare centers, in schools. We started to introduce COVID-19 to them and to refresh their mind about the universal precaution and just introduce the topic because it was really new. Then February passed, March, April, even before end of February, hospitals started to downsize. They started to do layoff nurses. And despite the pandemic, many nurses, around 30-40% of our nursing workforce were laid off, and the remaining were working under very tough situations. No PPEs or minimal PPEs, 2 masks every 12 hours maximum, and sometimes no gloves, and cut in their salaries. They were given unpaid vacations. Many of them, they worked months without getting even a single penny. Then we had, on top of all this, we had the Beirut Blast, and you know this was the third biggest explosion in the whole world, and the whole city of Beirut was demolished or destructed, and we had 4 hospitals that were completely demolished. We had 6 nurses who were killed on the spot while on duty, and many of our nurses were wounded. And despite all this, the nurses stayed in their hospitals, and they continued to rescue patients who were at the hospital, who were injured, and other people who were living in the city of Beirut, and they did not know that those 4 hospitals were completely demolished, and they were running to hospitals to seek help. And here I would like you to please see the film that we have put on YouTube. You just put Order of Nurses, Beirut Blast, and you could see what our nurses, heroes, did to really salvage people's lives. And then after all this, because of the low salary, because of low unpaid vacations, because of unavailability of proper PPEs and all these things, our nurses started to migrate. And I don't call it migration, I call it exodus of nursing, Lebanese nursing workforce, because we lost almost 1,600 of our nursing workforce. And not only any nursing workforce. You have to know that in Lebanon, nurses are divided into two groups. 49% are holders of bachelor degree or university degree, and 51% holders of technical degrees. And those who are leaving are the holders of the bachelor degrees. And not only this, they are also the ones who have the most experience. And we all know that nurses are the backbone of any hospital or healthcare system, and we are losing this backbone. Why? Because in Lebanon, our problem is not in number. Last year, we graduated 1,200 nurses. This year, hopefully, starting June 2021, we will be graduating like around 1,700 nurses. Our problem is with retention. Also, by losing our experienced nurses, we are in big trouble because we don't have the needed number to train the new orientees in the hospital. And this is extremely dangerous. So I'm sharing with you some of the pictures, the revolution, the explosion, and some of the pictures that we lived. And mind you, August 5, we declared it as the strike day for nursing in Lebanon. But because of what happened August 4, we stopped on August 4, 10 minutes after 7 past 6, we stopped the strike for the second day. And all nurses were asked to go to hospitals to help. Some nurses who were living in the suburb, who were not able to reach the city of Beirut, they donated blood. So they did not stay at home. They went to their hospitals in the suburb, in the south, in the extreme north, and they donated blood. So as order of nurses, in order to really stand and really fight all what was happening, we had to work at different levels. We had to work at the strategic level, and also we had to work at the operational level. So what did we do? At the strategic level, as order of nurses, we have we reserved a place at the National Emergency Committee for COVID-19. So we were there sharing in the decision making. And also we invited all health orders in Lebanon, and we met and at the order of nurses, and we discussed what we should be doing as orders, because the economic crisis started at that time, and we wanted to preserve the funds of our orders. Also, we had several meetings with the Health Parliament Committee just to raise the voice and to shed the light on what was happening in the country in terms of the situation of the nursing workforce. At the operational level, as I mentioned, we started training for nurses working in hospitals, primary healthcare, schools, even borders. We had nurses at the airport, at the in the north, also on the borders, before the registration of any or the first case of COVID. The members of the board of the Order of Nurses, we took the hotline that was done by the that was opened by the Ministry of Public Health, and we maintained it for 2 months. So every night from 7 p.m. till 8 a.m., our board members were answering hundreds of calls from people who were really worried and afraid from COVID. Also, as Order of Nurses, we were the body that assessed more than 400 isolation sites in Lebanon. If you know, I don't know if you know that the government created isolation sites for people at the beginning of the COVID who were affected by COVID and could not stay home. So the Order of Nurses headed this committee with the Lebanese army, and we assessed more than 400 sites all over Lebanon. And by doing this, we were able to create jobs for our nurses with WHO, and those jobs were paid in dollars. So we gave the jobs to nurses who were laid off from their hospitals. Also, we met with the President of the Republic, the head of the government, head of the parliament, ministers of health and labor. And we were able to issue decrees from the Minister of Labor asking all hospitals that to consider any isolation 14 days or 10 days should be counted on the expenses of the hospital and not taken from the nurses' vacation or consider it as unpaid days for the nurses. So this was something very important because hospitals, any nurse who was affected by COVID and isolated, they were cutting from the salary. And also we were meetings with the National Committee for the prisons to really see what we can do for the prisoners, and we are still meeting just to preserve the prisoners. Also, we are on the, okay, I will continue later. So we followed up on nurses' layoff issues, nurses' rights, PPEs. We called for many press conferences several times. We raised the voice, we shed the light on what was happening. We called for strike. And also we secured funds to get a hotel for the nurses who got the COVID-19 and who didn't need hospitalization and didn't have a place where they could stay home. So we got them a hotel, and we were hosting them for 14 days at the beginning, then 10 days for free on the expenses of the order, of course. We used media as a platform for raising the voice. So we really built a very strategic relationship with media. And we asked for national recognition for the deceased nurses, whether from August 5 or nurses who died from COVID-19. And in both cases, we succeeded. So all nurses who died from COVID-19 will be considered as martyrs, like the Lebanese army. We also kept on working at the regulatory level, and this is extremely important. And we were able to secure one decree, and now we are hopefully the second decree will be out. Also, at the operational level, we did awareness videos for the population of Lebanon about Corona, what they should be done, the social distancing, hand washing, mask, also for pregnant women, and also videos for nurses. We all know that in Corona, patients were admitted without any family support. They were on their own. So nurses were their families, and they were staying like 2 weeks, sometimes in the hospital with no visiting. And nurses also were their the only person that they saw. And at the same time, nurses were seeing those patients and meeting their needs on daily basis without any help from the family. Also, patients were dying on their own with the nurses. So our nurses were put under high, severe psychological stress. This is why we did the sessions, and we know that seeking psychological help is still a taboo in Lebanon. So we did sessions, awareness sessions, just to tell nurses that it's not a taboo. If you feel those symptoms, please, you can seek help. And we ensured that one NGO embraced that really give this support, to give support to our nurses and for free at the expenses of the order. Also, we secured funds for August 4 wounded nurses or nurses who lost their homes, their cars, and we were able to, all those who responded to our call and presented the needed papers, we paid them in dollars. Also, at the strategic level, we were at the sitting at the National Vaccination Committee, and we succeeded in putting nursing as a priority of the priority. And then we secured vaccination for all nurses. So almost 95% of our nurses are vaccinated, except those who got the COVID and those who refused at the beginning. And as I said, we secured jobs at the beginning with WHO, and now we are securing jobs for nurses, also paid in fresh dollar with the Red Cross through the initiative that we started with the Red Cross, which is related to providing community care to COVID patients. So how did we come up with all these things? Because we really like to take the eagle as our motto, and especially we look at how eagle behave under the storm. And we know that eagle know when a storm is approaching long before it breaks. So the eagle will fly to some high spot and wait for the winds to come. And then when the storm hits, it sets its wings so that the wind will pick it up and lift it above the storm. While the storm rages below, the eagle is soaring above it. So the eagle does not escape the storm. It simply uses the storm to lift it higher. It rises on the winds that bring the storm. And this is what we try to do. We knew that we were living in a tornado, and we tried to be above this tornado, and we used the wind really to help us set high so that we could be able to deal with the situation. So how did we do actually operationally? We created strategic alliances with key people in the country. We never took no as an answer. We made a presence at the decision-making table, and we used the power of knowledge to really make people value our presence. We developed tenacity to bounce back from negative responses. We identified strategic stakeholders, and we engaged the public and the stakeholders with us. We empowered nurses through different strategies, and we did all this using the media and communication, which is extremely important. So we took the main strategic alliance was with the media people because they made our voice heard. And ICN declared again this year that nursing needs to be a voice to lead, and we were able to make from the Lebanese nurses a voice to lead and also a voice to be heard. And this is something new within our culture. I think this was the first time since the inception of the Order of Nurses in 2002 that really the light was shed so heavily on the nursing profession, and we took our role, we played our role, and we had a say in the decision making. Why? Because the future depends on what you do today, and we want the future to be good for us. We want nursing to be a voice to lead, a voice to be heard. And once you choose hope, anything becomes possible. Thank you.
Yeah, thank you. Thank you, Dr. Doumit. This was a great presentation and shows what the Order of Nurses has done preemptively to try to diffuse the situation that is happening currently in Lebanon. I mean, if you look at it in any way, it's a multitude of crises that happen at the same time, and it's rare for one of them to happen. It's even rarer for all of them to happen at the same time. And that shows also the importance of having, I think, an order for professions, like an order for the nurses, because then you could have a body that would speak for everyone and try to get the best interests of everyone. So my question for you is, so let's start back with the history of nursing in Lebanon. Like, how many nursing schools are there right now? And when was the first nursing school formed in Lebanon?
Now we have around 21 nursing schools, like if we want to count the universities. And the first nursing school belongs to AUB, School of Nursing, that started, it was the second school started at the American University of Beirut. At that time, it wasn't known as the American University of Beirut. Then we have the USG, and USG, it's their 96th year as nursing in Lebanon, but as a faculty, last week they celebrated their 40th year, whereas AUB, they celebrated 100 plus year. And we started with AUB and then USG, and then we have all the others.
Okay, and so
it's good. Thank you for this question. Thank you for this question, because recently we noticed that the number of young people joining schools of nursing has increased. So maybe the pandemic has served the profession, and we are seeing more young people joining schools of nursing now in Lebanon.
Which is a good thing, hopefully,
yes.
for the future of nursing in
yes,
Lebanon.
We hope so.
And before the crisis, where the numbers of nurses graduating, they were able to cover the needs of the country, right? Or were they even more than what the country needed?
It's a complex question. Why? Because in Lebanon, we never followed the nurse-patient ratio. And if we really want to follow the nurse-patient ratio according to international norms, no, the number of nurses is not enough. But if we want to follow it according to what the order has put it, we started to work on it just before the revolution, and we sent our recommendation to the Ministry of Public Health because to have 8 patients per nurse on regular units, and then of course for the ICU it's 2 to 1, pediatrics it's less, depending on the units. And we were following up on it, but unfortunately the revolution started. But we can see now that in some hospitals they put 18, 19, even 20 nurse, 25 patients per nurse, and this is very very dangerous. We highlighted this, and at that time in 2019, and the ministry was about to follow our recommendation, and everything started. And so now the plan starting next week to follow up again on this issue. So the number in Lebanon, our problem mainly is not with number. If we know how to keep the graduates, then we would be safe.
Right, and going into that right now, so it seems like there's two major problems going on. The nurses had a certain quality of living before the revolution, and then suddenly there was significant crash in the value of the Lebanese currency. So have the salaries of the nurses changed to reflect this devaluation of the currency, or have they stayed stagnant and have not changed?
Unfortunately, in some hospitals, they are still the same. So now they are worth like $40, $50, $60 per month. In other hospitals, they were able to foresee the situation, and only recently, they started to think about compensating. So some big university hospitals, they started to give some fresh dollar, some lolar, and others, they have started to give 13 months, 14 months. So, but as order of nurses, we called 6 weeks ago, we called for an emergency state in the country for nursing, and we asked that 40% of the salary be given at the lolar level, which is 3,900, and to give more compensation for school, for university, and to consider to decrease the number of working hours in the private sector to meet or to match the public sector. So to decrease it from 42 hours per week to
35 hours per week.
To match public sector, to match the public sector our number of hours. And we discussed it with the Ministry of Public Health. We discussed it with the president of the syndicate of private hospitals, and we said it out loud in a press conference. And we are still following up on this, hoping that hospitals will start following this plan just to salvage what is remaining from our nursing workforce.
Right. And so when we talked about nurses leaving, I think you mentioned the percentage of nurses who are qualified or have worked for a while in the country
yes.
versus the new nurses. So when you say 1,200 or 1,300 nurses have left the country, what percentage are nurses who have worked for a while in the country versus nurses who just recently graduated?
Almost all of them. 90% are experienced nurses.
Okay. And because
countries are not taking new graduates.
Okay.
So where did they go?
Yeah, which countries did they mainly go to?
We started with Europe, and then USA, Canada, and Europe, I mean UK, Belgium, France, and then now we are with UAE, KSA, Iraq, Qatar. So, the Arab countries, and we have an exodus of nurses, really. Every day we sign like 10, 20 papers.
Wow. And did some of the initiatives that you took, for example, the community initiative for COVID-19 or other initiatives that pay nurses and fresh starters, have they stemmed some of this tide, you feel, or it's still ongoing?
To tell you the truth, for the past 2 weeks, we noticed that the numbers started to decrease. Either those who wanted to leave left, or maybe those who are cashing in dollar are just thinking twice before leaving. But if the situation continues like now, I'm sure all of them would again consider leaving.
Right.
Unfortunately.
And that goes to, I mean, I think it's very important that the initiatives that all of you are doing and what you are doing right now, but it's also important for the politicians in the country to listen to what's happening and try to solve the situation, to keep all professions in, and especially nurses, I think, because nurses are needed all over the world.
Physicians, Khalil, physicians
right.
are leaving as well.
Right.
Young physicians, experienced physicians with specialties, subspecialties, they are leaving, and our hospitals soon will become empty buildings. So we're in a big mess unless they start thinking of what they are doing. Our politicians, we're in a big mess.
Right, because now we're depending on individual initiatives or some collective initiatives to try to stem the tide, but you can't do it when the country is not running in the right direction.
Exactly.
Can you tell us a bit about the initiative for the community service for COVID-19? It's through Khadid Beirut, right? Is it that one or
no? It started initially with the Order of Nurses, Order of Physicians, Beirut and Tripoli, and the Red Cross. And we wanted to do something because we were foreseeing that the numbers of COVID would increase after what happened in January with the outbreak. And then because we were foreseeing that we had Easter 1, Easter 2, and Al-Fitr, Ramadan. So we were foreseeing that cases would increase and hospitals will not be able to really accept all these patients. So we started to talk, and we have put a plan for this, and the finances really are coming from the Red Cross. They were able to get a big fund for this project. And later on, Khadid Beirut joined. So they were not initially in the beginning or the initial meetings, but later on they joined, and they are now meeting regularly, but with the team. But all the nurses are channeled through the Order of Nurses.
Okay.
And training were done by the Order of Nurses. Al-Khadid Beirut, they are doing some training, but we did also several trainings.
And how can people, if people want to donate to these initiatives, how can they donate to them from outside the country?
It's through Red Cross, really, because the funding, the payment is through Red Cross. Also, Red Cross is channeling through municipalities. But why?
Yes, we were saying that the Red Cross is channeling through municipalities.
Yeah, through municipalities. And we give it to Red Cross because Red Cross has already the infrastructure for this. They have the centers all over Lebanon. So we said that we don't need to reinvent the wheel, especially in the midst of a crisis. So people, they call the Red Cross number And then, as order of nurses, we provided them with the nurses in each region of Lebanon, and we made sure that all the nurses are belong or affiliated with the order of nurses, and they have the proper qualifications. And then the Red Cross is distributing or sending physicians and nurses according to need. Municipalities also, they are helping by introducing people to the initiative, because each municipality knows well the people living in the area.
Okay.
So this is why we call it community. It's really the effort of many people together.
Right. And we'll talk about one more crisis, I think, and then we'll probably conclude the session. But the other crisis, we talked about the economic crisis, we talked about the COVID-19 crisis, but then we have the August 4th blast, which I was there, you were there at the time, and physicians were there. I know from a physician standpoint, physicians were there and they went down, and everybody saw the number of injuries that happened that night. But I think nurses were actually some of the people who were the most at the forefront of this and bear the major brunt of this, I think, response to the August 4th explosion. So how was the psychological impact of this on the nurses on top of everything else that was going on?
It was very big, very taxing, not only on the nurses, on their parents, especially nurses who died, and their families. We are still in contact with them and we support them, the colleagues, nurses who were injured and who are still suffering from the sequelae of the injury. So really the situation is really bad. Some nurses left their job because they could not go again to the same place of work and remember their friends who were killed, who were slaughtered by glass on the spot. So it's not easy to see your friends dying. It's not easy to remember. I guess you saw the film and you saw what the nurses did. They were injured themselves and they were holding patients on their back from the 10th floor down to the lobby, or what we call lobby, because nothing was left, just to salvage them. So it wasn't easy. And a whole city was completely demolished. Every citizens in every street, they thought at that time that the blast was in their street. So it was so big. It's the biggest that we have ever seen or lived. You know, myself, I lived the whole war in Lebanon, but I've never seen such an explosion. So 4 hospitals completely demolished, many people died. But at the same time, the healthcare sector has proved that nurses, physicians, hospitals, we are all superheroes, because we were able really to contain it in less than 20 hours. It wasn't easy. All hospitals in all Lebanon were open, patients even reaching Tripoli. So in no time, people were helping. They were rescuing patients, citizens on the street. They put them on their motorcycles, in their cars. People were helping. Really, you could see the spirit of the Lebanese people, and how Lebanese people, when we have a catastrophe or something of this sort, they help each other regardless of religion, gender, and areas of living. So people were helping each other. Our nurses really were superheroes, and I cannot find words to describe what they did. In less than 10 minutes, they were running to hospitals to support.
Right, and I think this video that you were talking about shows that, and I will put a link to this video on the podcast and YouTube site so people can watch it. And yes. So Dr. Doumit, I think the Order of Nurses has done a tremendous job in the past year and a half. What is your message to the officials in the country and to the expatriate Lebanese outside the country at the end of this podcast?
For the officials, I tell them, if you keep on arguing, we will lose our country, and then your arguments would be of no meaning, or you're arguing together, or your problems would be of no meaning because we would be losing our country. Yeah. For the expatriate, I tell them, I understand your reasons for leaving. They might be legitimate reasons, but for myself, I always say Lebanon or our country is not a resort. So it's not when the country is doing well, we come and benefit. And when the country needs us, badly needs us, we leave. So if you have left, then make it a point to serve your country from where you are. See what are the needs of your country and serve those needs. Do not give depending on what you think is good to the country. Do a needs assessment, a real needs assessment, and really provide the country's needs, because your country needs you.
Right, and I think it's good. I mean, I think expatriation has good and bad things to it. I mean, the bad thing is you have a brain drain, but the good thing is also you have people who have connections outside the country who can help out. And Lebanon has always depended, I think, a lot also on the expatriate community to help out.
So we have to lobby, we have to work at different levels. We have to lobby for Lebanon. We have to change the external politics regarding Lebanon. We have that people outside Lebanon have about Lebanon. Send fresh dollar to Lebanon because your family needs it, and and we need to salvage Lebanon, the monetary, the financial status of Lebanon.
Right. All right. Thank you, Dr. Doumit. That was a great discussion that we had, and I hope people have learned about the importance of nurses and nursing in Lebanon, and the importance of trying to uphold it and keep it and improve it. Actually, I hope in the future things will get better, and it will be better than it was even before the revolution.
I hope so. I hope you were able to get something positive out of all this, is to make people understand and politicians understand what the real meaning of nursing.
Thank you.
Thank you. Bye.
Bye.
Night. Bye.